So hi everyone, my name's Adrian Richards and I'm a plastic surgeon and today I'm going to be talking a bit about breast enlargement and we're going to be really talking about who's suitable, what approach is suitable, how you choose your implants, what technology there is out there to help you, what the experience is like. And we're lucky enough to have one of our previous patients, Carly, joining us, and she's going to be telling us about her experience. So any questions you've got about the experience, either to myself or someone who's actually had the operation recently, like Carly, please put those questions down there. We'd love to hear them. So the first thing is that I work with the private clinic, which is one of the largest groups in the country specialising in private medicine with, really top-notch reputation and great facilities around the country, but in Harley Street and also in Fitzroy Clinic, with a hospital where I tend to perform surgery in Fitzroy Square. Next, please. So I'm a consultant plastic surgeon, which basically means that I qualified in the traditional system and I worked in the NHS at Stoke Mandeville for a number of years. And I was actually a hand surgeon for many years, putting hands and fingers back on. And now I focus essentially purely on breast surgery. So most surgeons tend to focus more and more later in their career on particular niche areas, and I focus essentially on breast surgery. Next slide, please. So what we're going to do, we're going to be talking about the whole journey, our stepwise journey to help you get the best possible results from surgery. So the first thing is an inquiry. So if you make an inquiry, you'll talk to our helpful team and they normally schedule a virtual consultation. So that's when we meet you online. And the reason we do this is really to save you unnecessary trips because some people aren't suitable or may need to think about it. So we like to meet you online and we meet people from all over the world. And it's really good experience to get a flavour of each other. Then we can guide you to the right information. So I send you a letter with all the information about the procedure. We then like to do a 3D scan. So it's very important, particularly for breast augmentation. We have a very advanced bit of software. Perhaps we could have a look at that next, on the next slide, called Chrysalix. And what we can do is you send us 3 photographs in a very secure portal. And from that, we can do a 3D reconstruction of you with different sizes of implants. And then from that, you tell us which one you prefer, and that guides us onto the optimum profile for you. So this is an example of the Chrysalix. It's quite complicated. It will tell us your breast volume. It will tell us all the dimensions of your breast. And most importantly, you can see how you might look after an augmentation with different sizes and shapes of implants. Next one, please. So we'd like the Chrysalix because it really gives us a good starting point to analyze your breasts and what is possible. The virtual consultation, here's a picture with me and my dog, and Melissa's normally with me as a chaperone. And the idea of this will meet you, talk about your concerns, talk about your wish list, and then we'll be able to discuss the options and give you that information. And if you feel it's the right thing for you, we like to meet you in person. So when we meet you in person, I'll be able to do more detailed measurements and explain in a bit more detail exactly what the options are for you. Next slide, please. So this is the information you will get. So very important for any procedure that you go into it with as much knowledge as possible. So we really like you to read a guide. So for breast enlargement guide, the consent form that you're going to need to sign before the operation. And we'll send you links to lots of before and after photographs and a quote. So we want to give you every single bit of information you need to make the best decision for you. So if you've got any questions out there, please ask away. Carly or I will be delighted to answer them. So you've had your virtual simulation, see how you might look in 3D. we've met you and written a letter to you outlining the options, then we need to meet you in person. So next slide, please. Now, it's very, very important. So people talk about cup sizes, what sort of implant would suit you, what sort of size would suit you. And it's really important to understand that it's a proportion thing. So the same breast implant will look really different on different people because their build is different, their height is different. So if you look at the photo here, these are all patients we've treated with implants ranging from 240 5cc to over 400 cc's. And the important thing is the cup size is not determined so much by the implant, it's determined by your proportions and that relationship to the implant. So next slide, please. So the most important measurement is to measure the natural width of your breast. So the base footprint of your breast in centimeters, and that is the column on the left, okay, in centimeters. So people's breast base can vary between 10 centimeters to 15 centimeters, as we can see here. So generally, as implants get bigger, more cc's, they also get wider. So we need to select an implant that suits you, that fits inside your breast tissue. If it's too narrow, it won't give you good cleavage. And if it's too wide, it tends to come out under the arm. So we need to tailor make the implant for you. So what we will do, we'll do those measurements, okay? And then can you see the different colors? We have 4 different profiles of implants. So the implants we tend to use are made by a company called Motiva. I believe they're the best implants on the market from all our research and all my experience. And we tend to use mostly the Motiva ergonomics implants, which are very soft and they go teardrop shape when you become upright. And there are 4 different profiles. So for any particular width, there are 4 different heights. So as they get bigger with the increased profile, they don't get wider, they get taller. And we can make recommendations for you as to which one would be best for you by analysing your preferred picture on the 3D. And actually, we will try all the implants as well, so you get an opportunity to try them. We've got a couple of questions here, so thanks, guys, for the questions. One, does it matter whether you have surgery before or after children? The answer, that's a very good question. So we tend to mostly operate on people either in the window before children or the window after children. So we don't tend to operate too much on people when they're having children, because the breast is constantly changing during that time. So those are generally the 2 windows, either before or to resolve issues once you've finished your family. Another question, how do you know when implants need replacing? Another good question. So implants, these modern implants, don't really change very much. It's more your body changes around the implants. So we generally recommend that you have a scan, an ultrasound scan, to look at the implant at 10 years and then every 5 years thereafter. If there isn't an issue with the implants, we don't need to change them just because they're a certain age, because they're so well built nowadays. But if the scan showed any evidence of any abnormality, then we could discuss changing them. Ooh, the questions are coming thick and fast, so thanks, guys. Catherine, I'm interested in a breast reduction uplift. Is this a procedure we do? Yes, it is. Actually, we've done a webinar on this as well. So if you look at our Instagram page, you'll see our previous webinar where we talked to a lovely patient who had a breast reduction. So it is something we do, but we're not going to talk about that today, unfortunately. But please look at the webinar and contact us. So we will measure you and tell you what implants would fit you, a range that would fit you. You then make the final decision. So when you come to clinic, we have lots and lots of different implants. We encourage you to bring your own clothing so you can see how you look with different implants in your own clothing. And ideally, if you can bring someone else as an external sort of opinion, that's great as well. So then you will be able to choose your implant size, within our sort of parameters. This is the picture just showing you the width. So this lady's width is 11 centimeters, and that corresponds to an implant 265 cc's in the Motiva ERSD, which is that purple one, which is the most natural implant. So again, we have to measure you to make sure that you get the optimum appearance for your particular body shape. So next photo, maybe we can get Carly in here. Carly.
Hello.
Hi, Carly. Could you explain how you chose your implant sizes?
So I had my sizing appointment in the clinic, and I was really, there we go, start my video. I kind of overthought the whole sizing process really quite a bit, because I'm quite a small frame. I'm quite athletic with low body fat, and I'd been told by pretty much any other kind of company that I'd gone to for the procedure that I'd have to have it underneath the muscle. But as you said, the Motiva ergonomics implants are really soft. So I was kind of less concerned about going a bit bigger. You measured my diameter of my breast and decided that it was 11.5 centimeters. So I had a small range of sizes to choose from. I think I left it down to you in the end, Adrian, because I couldn't decide. I selected two sizes, 285 and 300 cc's. And I asked you to decide, as you were doing the operation, which one best fitted my frame. And I wanted to have a bit of cleavage and a bit of side boob, and trusted your opinion, really. And I couldn't be happier. They're brilliant. So, yeah, I lost quite a lot of sleep over trying to make the decision.
Yeah.
But I do think you can overthink it a little bit. And I think that's where I ended up. But
yeah.
Got the best decision in the end.
Yeah, I think you're right, Carly. And the other thing we do when you're asleep is we use a temporary inflatable implant just to check the size you've chosen is good. So I'd just like to say Carly is very fit and a healthy person. So we could talk a little bit about the management of the muscle, particularly for Carly, who uses her muscles a lot. So I've got a quick question. Activities post-surgery. So is this Carly? No. So you see, this is a great question for you, Carly. Someone has said, what activities can you do following surgery? I'm super active. I'm in the gym. I do weightlifting. Would be able to get back to this level eventually. So, Carly?
Okay. I do a lot of running, and I also do CrossFit. So I'm in there with the heavy lifting and the weights. And I, pre-surgery, train 6 times a week quite heavily. I did mention this to Adrian and Melissa, and they sort of, looked at me to say, well, you won't be doing that for a little while, which is true. So I did take some downtime, and I put the weights to one side. I packed them all away the day before my operation, to be honest. I wasn't even tempted to pick them up. I did hire a treadmill, which they know about. I did only do walking for a little while. So I did uphill walking for about a week or so. And I did some body weight exercises, but I avoided kind of moving my arms and lifting any heavy weights for about 5 to 6 weeks after the operation. But I am just about 8 weeks post-op now, and I'm doing everything as I was before, and absolutely fine. So full range of motion. I didn't lose much fitness or strength in that rest period. So and for me, to be honest, that was one of the major things that put me off having it done, because I thought I can't not be in the gym, I can't not run, I can't not lift weights. But that rest period was absolutely fine. You shouldn't be concerned about it, because I'm back to where I was before the operation now. So yeah, not something to worry about.
Lifting the same weights, Carly?
Yeah, same weight.
That's good. Carly, question we quite often ask is, I don't know whether you felt this, but people are nervous about the anaesthetic. So we always explain that anaesthetics have changed a lot. They're much gentler now. So can you explain how you felt with the anaesthetic?
I was really scared, actually. I had not had an operation before, never had a general anaesthetic. So I was really, really worried. I was worried about feeling sick when I woke up. I was worried about how I'd feel as I was going to sleep. But the whole team were fantastic. As I was going to sleep, I felt relaxed. I wasn't panicked at all. And I think the biggest thing on my mind when I woke up from the anaesthetic wasn't feeling sick at all. I didn't feel groggy. I felt like I was waking up quite naturally. And for me, having not eaten since 9 o'clock the previous night, I just wanted to know where my ham and cheese sandwich was, because I was quite hungry. But yeah, I woke up, I had something to eat, I had something to drink, no grogginess, no nausea, nothing. And I think it was, within an hour of waking up or so, I was on my way home and felt brilliant. So yeah, again, nothing to worry about there at all. The whole process and the anaesthetic was fine. So yeah, brilliant.
Another question for you, Carly. You're doing well with the questions.
That's
How
okay.
much downtime do you think you would recommend?
So for a good 2 days after the surgery, I didn't do a great deal, but I also wasn't in a lot of pain either. I just took paracetamol for pain relief. I did have some stronger pain medication given to me by the clinic, but I didn't. Yeah, I didn't need to use it. I tried to stay ahead of the pain. Yeah, but after a couple of days of just relaxing, I was out going for walks outside and on my treadmill. I'm a teacher, so I had my operation done at the start of February half term. I had a week off work, so I had it done on the Monday and I was back at work the Monday afterwards, and I found a week was fine for me. But I think if your job is a bit more kind of labor intensive, or you're using your arms and picking things up, you might need to take a bit more downtime. But I gradually built my training up slowly and listened to my body in terms of downtime with the training side of things. And everything worked out really well. So yeah, listen to your body, I would say.
Yeah, that's a good tip. Another question for you. Well, so this is from Jessica. Is there any loss of sensation to the nipple? So before you answer, Carly, it can happen. It's unusual, and it depends on the pattern of your nerves, how they come in. Carly, did you notice any difference?
Okay, so probably for a week after the operation, things felt a bit numb. Yeah. But they went from numbness to hypersensitivity. So if I kind of brushed my arm over my nipples, I was getting dressed or something, I thought it went, oh. But then it's gone back to kind of how it was before. So it went from losing a bit of sensation after the operation, and then I think afterwards, the nerve tissue kind of recovers a bit. And then it went a bit hypersensitive, but now it's gone back to normal. That was something that I was a little bit worried about. Yeah. Sort of not being able to feel anything afterwards. Yeah. But it went numb, then it went hypersensitive, and then it's gone back to normal. So absolutely fine for me.
That's good. Sometimes, because with the scars in the fold, so sometimes the skin just above the breast fold is a bit numb, but that takes months to come back. Does come back, but that area can be numb for a few months. Okay, so another question, why do we consider the Motiva implants to be the best? The reason is, I've used a lot of implants in my career, and one of the main issues we used to get with implants is capsule formation. So capsules, the lining, so basically, if anything that's put into your implant, your body, the body realizes isn't part of the body, so it makes a wall around it, and that is called the capsule because it encapsulates the implant. So everyone has a capsule, but it's normally very soft. Some of the older implants, the body could react and become the breast becomes slightly firmer, but we've never had a case of that with Motiva implants because they've got specialized surface, so that's great. They're very well made. And most importantly, there hasn't been a reported case of ALCL, which is something very important to understand before breast augmentation with these implants because of their non-reactive surface. Right, we've got a few more questions, but we probably best get on with the presentation, if that's okay, guys. But keep the questions coming. So at your pre-op assessment, we will go through your medical history and may take some blood samples and possibly some urine samples if necessary. Next one, please, Becca. You'll come to the hospital. It's number 1 Fitzroy Square. We'll tell you exactly what to do. You can drive very near it. Carly, how did you get there?
So I got the train down the day before. Yeah. And I stayed in a hotel. Yeah. So I was all relaxed and there was no rush and no flapping and stress to get to the hospital. And then my sister dropped me at the hospital, and then she sort of hung around, had a coffee, did a bit of shopping, and then the hospital called her to come and collect me. So I got quite nicely dropped off by my sister.
Yeah. How long, what time did you go in and what time did you come out?
So I think I went in at about 10:30, quarter to 11 in the morning.
Yeah.
And then I remember waking up just after 12. And then, yeah, demanding the ham and cheese sandwich, and that was it really. So, yeah, very quick operation. And yeah, as I say, waking up and felt brilliant. So, yeah, no concerns about, the anaesthetic or anything.
Yeah. So in total, you were in the Fitzroy for how long, roughly?
So I suppose I probably, arrived. I can't remember what time I actually arrived. I wasn't kept waiting very long before I went in. I think I arrived about 9 o'clock.
Yeah.
And then had a few tests done. I was weighed and measured.
Yeah.
Got my gown on. Not lots of, but a little bit of paperwork to sign and sort out. Went into theatre about 10:30. Woke up just after 12. And I think I was on my way home by about 1:30ish, so it wasn't very long at all, really. Yeah,
brilliant. And the reason we've advanced that technique is better technique, more advanced surgical techniques, and use of local anaesthetic as well. So the area is numbed with long-lasting anaesthetic, which makes the recovery that much better. A couple more questions. Another one for you, Carly. You're doing very well today.
Okay.
How do you sleep after the procedure in the short and long term?
Okay, so this is one thing that I did find tricky for the first few days. I'm a tummy or a side sleeper, and I get all snuggled up. But I slept elevated on pillows at about a 45-degree angle, just to help the swelling. To begin with, that was difficult to drift off, but once I was asleep, I tended to stay asleep. At about 3 weeks, I kept finding that I'd slumped down or rolled over onto my side anyway. So I thought to myself that if I wasn't being woken up by my body, that was probably okay. I don't know if that's right, but I just carried on. For the last couple of weeks, I've been sleeping either on my side or my front. It's not been a problem. So from about, I suppose, six weeks plus, I've been able to sleep as I did normally. So I'm no longer propped up. But yeah, I got to a point in my recovery where in my sleep, I'd rolled over anyway, and I didn't wake up with any discomfort. So I just carried on with that, really. Yeah.
So that's a good point, Carly. So listen to your body, and if your body says it's fine to go on your side, your body's probably right. Would you recommend anything? Another question, would you recommend anything on the scars to help them fade, Carly?
I've just started using, I went and had my 6 weeks post checkup last week. And I've started using a scar cream now. I've completely forgotten the name of it, though. It's gone off the top of my head.
It's Helicoat.
That's the one, yeah. That's what I've been using. So I use that twice a day. After my shower in the morning, and then I put it on again before bed. You don't need very much of it because a little bit goes a long way. But I think, my scars are very small, and they're slightly pink. They seem to have healed and recovered quite quickly. So I think they'll fade to, a white color and be, barely noticeable. They're right down in the fold beneath my breast already. So.
And we're using shorter and shorter scars now. So so when we started, they might have been 5 or 6 centimeters long, but because of better techniques, and particularly we use a funnel, a special device for inserting the implants, they're much shorter now. Another question, I have 2 young children. I'm trying to work out what help would I really realistically need with my 2 young children, Carly?
It depends on the ages, really. I've got 2 children. Mine are 8 and 10, and I actually found that I could put them to work quite well if I need something lifting. Things like around the house, for me, it was opening the dishwasher was hard, like a pulling action. So I got them to do little jobs for me. Having said that, my mum did come and stay with me for the first 48 hours in case I did need some help, but I found it was okay. If they're children, sort of toddlers and babies that need lifting up, I'd say you might need some help with that. Yeah, I'm quite lucky that mine are a little bit older, so I'm not sure on the ages of your children.
Yeah. So if they're young and probably going to, I think if they're going to need lifting and jumping on you, you probably need help just in those first few days. Another point, just like to say, if you are an out of towner and you are having an operation, we like you to stay within the M25 for the first night after surgery. Just a little thing there. Can I bring a family member into the hospital with me before or after the operation? Melissa, you might know. No. Generally, because it's a theatre, we like to keep sort of throughput through the theatre, you know, as little as possible, because it just reduces the infection rate and everything. So generally, your family can be very near, they can be outside, but they don't actually come in, but the reception area where they'll be able to pick you up, and we'll be in contact the whole time with them. So typically, who was with you, Carly? Was it your sister shopping?
Yeah, it was my sister. And at first I thought, oh no, I've got to go through my first ever operation all by myself and I won't have someone there for moral support. Yeah. But when I arrived, everyone was so super friendly. And I was actually told almost like a schedule of what was going to happen. So I could tell my sister ahead of time that I'd be going into theatre at this time. I'd be out and able to be back on my phone at this time. So Melissa was kind of super efficient there. And I said, oh, you can expect a call around this time. So yeah, the hospital was in touch the whole time with my sister and she knew what times to expect me. And because everyone was so nice and welcoming and friendly, it wasn't at all as worrying as I thought it was going to be. Because I thought, oh God, operation, big procedure. I won't have anyone to hold my hand, but I really did have people there to hold my hand because everyone was brilliant. So that's not something you should be worried about.
Yeah, that's really nice. I mean, the team are handpicked to make it as pleasant as experience. Okay, so next slide, please, Becca. Now this is important. So the anaesthetic has changed. So the old-fashioned anaesthetics were mainly gas-based, so you were kept asleep by gases in a mask. Now we tend to use a technique, particularly for plastic surgery, TIVA, which is basically a more direct, gentler approach. And we monitor very carefully. We have a special machine to monitor your brain waves so we can make sure you're exactly the right amount of sleep. So we don't give you too many drugs, but you are securely asleep. And the recovery is much quicker. So typically, people don't feel sick and get back, feel strong straight away. So would you agree with some of these? I think we've been through the recovery period. Next slide, please, Bex. Now, bras are really important and support afterwards. The key for us is comfort. Okay, now other techniques that other surgeons use can involve straps and drains and all sorts of things to push the implants into place and a lot of taping. So we don't use any of that. We just have brown tape on the scar, which you can shower with after a week, and the bra, we will be fitted with a bra. We have lots and lots of different types for different body shapes, but we will explain which bra to use, and when you wake up, you will be in a comfortable bra. And the most important thing is that it's comfortable. It doesn't need to compress you in any way. I've put the implant in the right place. You don't need to be squeezed. We will give you antibiotics for 5 days. At the beginning of the operation, we give you a shot of antibiotics. So you've got high dose during the operation. And the theatres are the latest design, so very low infection rate. And we have antibiotics as well, just to try and absolutely make sure you're as safe as possible. Got another question here. Why should we choose you over others? Other surgeons? Just seen that question. Well, Carly, you can answer that one at the end. So there's a lot of great surgeons out there. So some of my friends, there's a lot of really great plastic surgeons, and we do see people, and so sometimes we will recommend another surgeon because he is the right person for you. So come and see us. If we feel we can get a great result, we'll tell you honestly. If we don't think we can, we'll find someone that can. Okay, so next question, or next slide, please, Bex. Now, after your operation, you will be given a 1-week appointment. So that's when you will see our nursing team, and they are just going to check that everything's fine. In the meantime, we have a 24-hour hotline. If you are worried at all, you can contact us, and our nursing team or myself will answer your question. So we see you at a week, and then we would typically see you at 6 weeks, which is the next slide. Is that right? Yeah. Carly, tell us about your post-op appointment.
So the 6-week one, I was in clinic just last week. I had some more photographs taken. I actually found them quite difficult to look at because I had the surgery to boost my self-confidence. And Melissa had taken the photos of how they are now, which I'm really happy with, and compared them with the pre-op photos. And I found it quite hard to look at. I was like, wow, did my body really look like that? So it was very different. So I had some more photos taken. And then Adrian came and had a look at how my scars were healing. And I was really pleased because you said I was ahead of schedule with my healing process.
Yes.
And that was it. That was about it, really. We had a quick chat as to how much exercise I had or hadn't been doing. I told the truth.
Yes. Which wasn't very good. No. So you went back to lift. Well, you went back to lifting, quite soon, didn't you?
I did, yeah. So, but nothing heavy. And like I said, I did listen to my body. I suppose by 5 weeks, I started to do a bit more. And then after 6 weeks, I sort of gradually built back up to where I was beforehand. But yeah, as I say now, I'm doing the same level of exercise and things that I was before. So my recovery has been, I think, quite quick. Yeah. But I think that's down to being quite healthy and having, a healthy diet and being, doing the exercise beforehand. Yeah. I think set me up quite well for a quick recovery.
Here's a question for you, Carl. Who has noticed?
Okay, this is a funny one. So I actually thought I was really worried about returning to my job as a secondary school teacher because there's lots of teenage boys around. Whether or not they've noticed, they certainly haven't had the guts to say anything to me just yet. It's a funny question. I had told quite a few people close to me that I was having the surgery done, so I didn't really get any, well, something's different with you there. So not so much that, but some of my close friends, not kind of necessarily noticing, well, you've had your boobs done, but have noticed, well, you look more confident and you're standing differently, and have complimented me in things I'm wearing, and I've sort of said, I think the thing for me is that beforehand I'd wear kind of lots of padded bras and try and wear things that would hide them, so maybe I don't look that different. But now I'm not wearing the padded bras and I'm more confident and my posture's completely changed. So that I think the people that would have noticed, I'd told anyway. Yes. But people that meet me on the sort of on the street, or people I've met since, or people at work, that didn't know, haven't necessarily seen them because they don't look unnatural, if that makes sense. Yeah. So I'm not trying to say, I should have had them done bigger so everyone noticed. I think they fit in with my frame and the rest of my body. And I wanted them to look natural. So I think that's my answer to that one. And that's the result that I got.
So noticeable, natural. Have you had to buy a new wardrobe, Carly?
I went a bit mad after my 6-week appointment, as Melissa's aware. I went and located Victoria's Secret and went and bought myself lots of nice new bras because I'm allowed to wear normal bras now. The rest of my clothes, to be honest, fit fine. I've even kept the same sports bras that I had before, but I have bought some more high impact ones. If I go for a run now, there's a bit of a movement issue if I wear my usual low support ones. Yeah. But my tops all fit, they just fit better, I'd say, than they did before, because obviously they're designed to have boobs in them, and I was very flat-chested before. So yeah, my clothing fits me better, I would say. So yeah, it's not an expensive complete overhaul of your wardrobe, just some nice underwear, I would say.
Yeah, thanks, Carly. A couple more questions. One, will we be recording this? Yes, we will, and it will be available via Instagram, the whole thing, if you want to see it. Next question is, why don't we use drains? So what is a drain, first of all? A drain is a tube which is put from the inside through the skin to the outside into a suction bottle. And the idea is if you have bleeding inside rather than collecting inside, it will go into the drainage bottle. So they're generally not nice drains. They get in the way, they're painful, and they hurt when they come out, and you normally have to stay in hospital when you've got them. The only reason for using them is if there's any bleeding, and the way we do it now, there is hardly any bleeding because of the techniques. So if there's no bleeding, you don't need drains. So that's why we don't use them. It's basically the old technique was much rougher. Now we're much more careful, much more gentle, stopping the blood vessels before they start. So that's why we don't need drains, which is a great advance, I think. Another question, if you were considering a tummy tuck or lipo, would you advise this before or after? So this is another good question. So you can have them together, and that's called a mummy makeover, but it depends how big your abdominoplasty is. If you're having a big tummy tuck, we may well recommend that you have your breast surgery at a separate time. We can talk to you about pros and cons of that. Generally, I tend to prefer to just focus on the breasts at any one time, because your body needs time to repair. So if you're having multiple areas, the complications are higher. So it's sometimes just best to fix one area at a time and focus on that. What is the benefit of wearing a compression bra? Good question. I don't think there's any benefit at all. They're uncomfortable, they limit your breathing, which is you need to breathe, particularly after an operation. A compression bar, sometimes we use when we remove implants, just to get the breast to go down, but I see no benefit in wearing a compression bra if the implant's in the correct place. There you go. So we don't like compression bras. Do the demi profile give more cleavage than the full profile? It depends on the width. So if the width is important, we always get the width right, because we don't want to go outside your natural dimensions. A higher profile implant increases the height of the breast, so it can increase the profile a little bit by increasing the height, but generally the cleavage is determined by your body shape and the width of the implant. Can I have a nipple reduction at the same time as a breast augmentation? All the questions are good questions. Yes, you can. It's quite a common combination, and you can also have an inverted nipple correction if you would like. If you have got pierced nipples, that's not a problem. We can take the piercings out just before the operation as well. So great, we're doing well. Next slide then, please, Becca. Okay. Now, this is a question we're always asked, and it's a biggie, really, is are you best having your implant in front or behind of the muscle? Okay, now, what muscle are we talking about? We're talking about the pec major, and that's a muscle which comes down here. Okay, so it's the one you build up when you're doing chest presses. It's one that you see all the bodybuilders have, and it's here, and it's a triangular muscle. Okay, now, when we used to use a lot of hard implants, so the old shaped implants were firm. They were like bricks. So we had to put them under the muscle to soften them. Okay. But one of the issues, if you have them under the muscle, is that they can move. So when you tense your muscle, they move, and they can move apart. And also, if you start doing more and more exercise, they can move separately. Okay. And also, if you ever need further surgery, it's much more difficult to deal with lining around the implants if they're under the muscle. So where possible, we would try to put the implants in front of the muscle, and particularly for someone like Carly, who wants to use her muscles properly, we don't want to interfere with muscle function, because when you go under the muscle, you have to divide some of the muscle fibers, which reduces activity. But we can talk to you all about that. We generally measure you and we will advise. Question for Carly, how do the implants feel in your body? Do they feel natural or hard, soft or cold?
So they feel really natural. I'm going to be really honest. Some of my friends at work and outside of work have asked to have a squeeze. That seems to be a common thing after you've had the operation. I think they're just curious.
Yeah.
And they've all said, oh, they feel really, really natural. So they are soft. I haven't really noticed them feeling hot or cold. But I would say I was worried about them feeling like they didn't belong to me. Which maybe for the first couple of days I'd be in the shower or whatever, or after the first couple of days showering, I'd look down and I'd see they were quite swollen. And I think, wow, they're not really attached to me. But now they feel like they're just part of my body. They feel like they belong, and they don't feel like they've been there for 7-8 weeks. So yeah, they feel really soft, really natural. They look really natural, and now they've just started to kind of feel like they do belong in my body rather than something that's been recently added in.
Yeah. And another point is, if we've ever changed implants from other makes of implants to Motivas, when we ask the patients, they generally say they prefer the Motivas because they're softer and they feel more like a breast. So patients tend to love them. Quick question, are recovery bras included? Do you have to purchase them? No, you don't have to purchase them. They're all included, and you'll be measured. We measure you, make sure you're fitted perfectly, make sure they're comfortable before you go. Breastfeeding is another question. Good questions. Yes, you are able to breastfeed after a breast augmentation. This is because all the breast tissue is in front of the implant. So the implant, whether it's behind the muscle or in front of the muscle, is always behind the breast tissue. So you can still have your mammograms and your breast examination as normal, and you still be able to breastfeed. After breast reduction, you normally cannot breastfeed because the ducts are divided, but an augmentation you can. And if you are going to have babies, your breast tissue will react how it would normally. You can breastfeed as normal, and your breast tissue, because the implant's underneath the breast tissue, the implant will react normally. So a couple of another questions. These questions are great. It's for you, Carly. Okay. How long for the implants to totally drop and soften after the swelling went down?
So I think the kind of drop and fluff kind of thing, I think mine are nearly there, to be honest. Yeah. My swelling kind of peaked at about 3 days after the operation, and then gradually went down. I'd say 7 to 10 days afterwards, they looked a lot more natural. They were quite high up to start with. I took lots of photographs almost daily. I became obsessed with taking pictures. If you saw my camera roll, it'd be like, oh, boobs, there's boobs, there's boobs. Like progress pictures, really. Yeah. But you can see as you scroll back through my camera roll, they're kind of dropping down. They're not sitting as high up as the swelling went down. I've kind of been keeping track of how they're dropping because to begin with, when they were high up, my scars weren't quite in the fold underneath my breasts. But as they've dropped, that scar has dropped nicely and it's pretty much in the fold now. So I think as far as them dropping and being less swollen and softening, I think I'm getting to that stage now, really, where I'm pretty much there. I don't think there's much more dropping and fluffing to go. I don't know, Adrian, you saw me last week. I think we're thereabouts.
Yeah, I think you're pretty much there, but initially they are a bit high. Now, fluffing is normally when we talk about under the muscle implants. So fluffing, because the muscle tends to hold the implants up, and that's why when people go under the muscle, they use the compression bands to push the implants down. Okay, and fluffing is when, particularly when they're under the muscle, they're high and then they go down. So you don't get it so much with in front of the muscles, the settling down and the achieving the natural shapes much quicker. Another question, are the teardrop gummy bear implants becoming increasingly popular due to the natural shape? So I think teardrop shape implants are becoming less popular. So a teardrop shape implant is an implant which is teardrop shape whichever way you move it. The implants we use become teardrop shape when you become vertical. So generally the teardrop shape ones are not used so much, number one, because they're hard, and number two, because they can move. So implants can swivel like that. So if you've got the fattest bit at the bottom and the thinnest bit at the top and they swivel, it's going to change shape of your breast. So in my opinion, you need to think very carefully about having teardrop shaped implants, but that's just my opinion. Okay, so we're going to see some examples here. Yeah, Carly, that's a good question. Do you think your breasts change in shape when you lie down and sit up?
Yeah, so when I sit up, because the Motiva implants are so soft, they do fall into a bit of a teardrop shape.
Yes.
When I lie down, they tend to move quite a lot like natural breast tissue would. Again, I think that's down to the softness. So when I lie down, for example, I don't look and see like two big mountains sticking up. They do flatten, which I think is another really good kind of plus point for the Motiva implants, because they do then look a lot more natural. Yes, they do kind of change as my body moves. Their shape adjusts to that rather than just being round.
Yes. Yeah, so I think that's a really good point. So they move like a breast would rather than being absolutely stuck on that pair of headlights. Yeah. Okay, next question. For someone who's completely flat-chested, how can you still achieve natural results with scar under the fold? So this might be an example of a lady. So I can see she's naturally athletic. She's got symmetrical bust. And nipples in a good position, and this is her afterwards with a 285cc demi implant in front of the muscle. Can we go to the next one? Another lady. So this one was under the muscle because she was very, very slim. This is a slightly older implant. We picture, and we may have gone up in front of the muscle nowadays. So dual plane it means under the muscle. So it's called dual because the upper part, the muscle comes sort of here. So the upper inner part of the breast is under the muscle, but the lower outer part isn't. So that's why it's called dual plane, because half of it's under the muscle and half of it isn't. So next slide, please. And these are just some examples. When you come into clinic, we'll show you lots more examples to try and find someone like you. And we're always posting on Instagram, so engage with us. We're always putting information out there. Let's just run through these pictures. So, very natural appearance. I suppose I tend to focus on very, very natural. So sort of noticeable, but natural. That's our sort of mantra. So occasionally see people who want very big implants, and that's just not us really. So I won't really do implants above 450 cc's because I don't think it's the right thing for you. They're too big, they distort your breast tissue, they're difficult to treat, and they're just too big, in my opinion. And they're going to cause a problem for you later. So very important to think about your body when thinking about implants. So next slide, please. Yep, another very natural result. But importantly, the patient's sort of chosen her result really from the 3D and also trying the implants. So it's really important to spend as much time possible, as much time as you need, looking at the implants before, to make the best decision for you. And some people decide really quickly. Some people come back for lots of appointments. That's absolutely fine. Whatever's right for you. Next photo, please. Again, picture from the side. See, she hasn't really changed her clothes. She just looks better. You look more in proportion. Your waist looks smaller. So you look more like you should do with your chest matching your hips. Look more balanced. Next photo, please. Again, another nice natural result. So important thing is, if you are thinking about implants, so a lot of people think about breast augmentation. So Carly, so how long had you thought about it before you?
I think I first looked into having my boobs done when I was about 20. I'm now 37. So it took me about 17 years to decide and actually go through with it, partly because just worrying about having an operation, worrying about time off training, worrying about a complication or something not looking right. So it took a really long time. And then I just got to 37 and thought, you know what, you only live once, and find the right surgeon, so and then went for it. So yeah, it did take a lot of time for me to actually do it. Yeah.
So I think that's good that you took a long time and researched it. So if you are anyone's thinking of doing it, the 3D is quite a good thing to do because it's free. You can do it on the Instagram. It's anonymous. and it gives you an idea of how you might look. So it allows you to have the choice of, you know, whether you think this procedure is for you. And the 3Ds, the link is in the bio on Chrysalix, and it's completely free, and you get the images, and it's a good way to start. And if you ever do want to see us, you know, we can refer back to those photos and give you detailed measurements and analysis of the best option for you. So I think we've done, you know, most of the questions. I'd just really like to say before we finish, a really big thank you to Carly.
No problem.
Finishing work and coming to help us so quickly. Thank you to everyone who asked questions. We know really helpful to have you answering questions. And I can see lots of the names of people who registered. So thank you for watching. If you're interested in learning more about breast augmentation, look at our Instagram page, look at some of the stuff on Facebook, maybe try 3D. And if you'd like, talk to us. We're a very friendly, approachable team, and we really want you to have the best possible result. So we're on your side to try and help you through if you think this procedure is for you. And also, if you are researching, a really great place to look is Real Self. This is a website which has reviews of real patients put reviews of their treatments. So it's like a TripAdvisor almost for plastic surgery. Have a look on that. And that will give you a good understanding of what's available in people's experience. And I believe if you're interested, our lines are open and the team are ready if you'd like to make an inquiry. So again, thank you to everyone who helped put this presentation together, Melissa, Becca, Louise and the marketing team, and a really big thank you for Carly for sharing your experience today. And thank you guys for watching. Have a great evening. Bye-bye.